Hello, my name is Ralph Seip, and today I will present to you the output of a clinical study done in collaboration with Dr. Naiem Nassiri at the Yale University School of Medicine. This study tried to answer the question as to whether the ultrasound imaging subsystem of a HIFU device is adequate for the treatment planning and monitoring of a HIFU treatment of peripheral vascular malformations. Vascular malformations are congenital abnormalities of blood vessels that cause pain, bleeding, and many other impairments. Currently, no definite cure or FDA-approved treatment exists to treat vascular malformations, and the outcome is variable with the therapeutic techniques that are employed, which include surgery, embolization, or others. We believe that HIFU can play a strong role in the treatment of vascular malformations due to its ability to thermally necrose endothelial cells non-invasively and with low morbidity. Before looking at the safety and efficacy of a HIFU treatment for vascular malformations, we needed to determine if the ultrasound imaging functionality of existing HIFU devices was sufficient to be used for vascular malformation treatment planning, delivery, and treatment monitoring. For this purpose, we designed a phase 0 study to investigate that, which I will be describing during this talk today. In a nutshell, we wanted to determine if the Sonoblate device, an existing solution for HIFU ablation of the prostate, could also be used for the imaging and therapy of venous malformations. Expanding the application space of an existing device to encompass new applications reduces development costs and accelerates clinical adoption of such technologies. To do this, we enrolled 10 patients in the study and collected workflow and performance data on probe placement, patient coupling, venous malformation visualization, venous malformation target alignment with the HIFU transducer's focal zone, the impact of patient motion on the results, among other metrics. After imaging with the Sonoblate device under anesthesia, patients underwent venous malformation embolization. Here are the results. We found that probe placement and probe coupling were satisfactory for this application, rating it as easy on our scale across all patients. We further found that patient motion on probe placement and imaging was only a concern for patients with venous malformations located in the upper trunk region and did not have an impact elsewhere. Here you can see some images where the Sonoblate probe is placed and is imaging various types of malformations located at different locations on the body. We also found that we could visualize and identify venous malformations in all cases using the Sonoblate and correlate these images to others obtained with MRI or high-frequency diagnostic ultrasound scanners. Finally, the bolus adjustment of the Sonoblate probe allowed for nicely targeting venous malformations in the focal zone of the HIFU probe, which could be positioned from the skin surface to a depth of up to 45 millimeters. Here you see the output of different imaging modalities and the good correlation between MRI, the diagnostic ultrasound scanner in the middle, and the Sonoblate images on the right, all enabling good visualization of the venous malformations. Based on these results, we have concluded that the ultrasound imaging and targeting ability of the Sonoblate is sufficient to be used in a venous malformation application, and that the current capabilities of this device could likely be extended for use in the non-invasive ablative treatment of venous malformations. This we are now getting ready to investigate in a future safety study. Thank you so much for your attention.